Total hip replacement is a solution for a lot of people with advanced osteoarthritis that's affecting the hip. For people who are undergoing this surgery, it can be very exciting to finally get long-lasting pain relief and restoration of physical function, but it can be very daunting at the same time. This type of surgery is a life-changing event for almost all the patients who I talked to who had it done. Studies in the Lancet actually show that patients expect their hip replacement to last up to 25 years in 58% of the people who had it done. One of the questions that get asked often in my clinic is that, Mark, I'm having the surgery done. Is there any way I can improve the outcome of my surgery? In this video, I'm going to show you how to best manage yourself prior to your total hip replacement. And I'm going to demonstrate to you a comprehensive but simple routine to prep your muscles and joints for this event. So if you're about to have this surgery and you want the best outcome following your surgery, then keep watching. For most surgeries, 90% of recovery happen in the initial stages. Now for total hip replacements, you'll get most recovery in the first 4 weeks. Now 4 weeks is the amount of time it takes for soft tissue to heal up. After this time, recovery generally slows down. Once the scar is well formed, it will be very difficult if you decide that you want major changes after that. As you can see, for a lot of people, this replacement is going to last your lifetime. So for you, it's important that you prep yourself to enable yourself the best recovery possible. So for you, it's important that you get fully prepped before you go into surgery. Now, study has shown that there are many factors that's going to affect the outcome of your total hip replacement surgery. Number one is pain level, range of movement of the hip, your walking stance, whether you're limping when you're walking. Now, your general function is going to be important, whether you can go up and down stairs, your general strength, your general endurance of your legs. And lastly, whether there's any deformity in your hip caused by this osteoarthritis. It's important that you get all these factors optimized before you go into surgery. Now, what I'm not saying is that you need to get all these factors perfect before you go into surgery. You know, some of these factors are caused by years of muscle tension, muscle weakness, and trauma. What you're doing is just work on the areas that you can improve on so you can have the best recovery possible given the limitations. Now, I want to start by showing you an exercise routine I get all my patients to do prior to going in for a hip replacement surgery. Now this exercise is called the bridging exercise, and it is a strengthening exercise for your buttock muscles. Now buttock muscles wrap around the whole hip segment, and as you can see, it wraps the whole hip replacement in its place. So it's important that we strengthen this area up to ensure that the hip is in its good position after the surgery. So in the lying down position, first of all, let's bring the legs up at 90 degrees. And then once you're ready, we relax out the shoulders and we gently lift the hips off away from the floor or the bed. So let's give it a go. Crystal, lifting up as high as you can and then gently come back down. So when we lift, we breathe in, and when we breathe out, we come back down. Don't forget to go as high as you can and then coming down. And a few more times coming up, and squeeze, really squeeze through the buttock muscles when you're up in that tall position. Let's come up again. And really squeeze right at the top. Can you feel that at the back there? Yep. And then lifting, squeeze, and coming back down. Now with this exercise, we're doing this for 15 repetitions, 3 sets. So to a total of 45 repetitions. Now the next exercise is about how to strengthen up your legs and your thigh. Like what I explained in the video, the leg and thigh strength and function is one of the main predictors to the outcome of your hip replacement surgery. So have yourself leaning against the wall for a wall squat. So your head, shoulder, and your hip is all against the wall. Now once you're ready, have your foot about 1 step away from the wall and your legs are hip width apart. Now once you're ready, keep yourself upright and we want to slowly slide against the wall downwards and stop there. And making sure your knee is not going over your toes. Otherwise you're putting too much pressure on your knees. So when you're ready, slowly slide yourself up and then coming down again. So that's the exercise, going up and down. Again, we're aiming for 15 repetitions, 3 sets, just like all the other exercises. 2 more, coming down and up. And last one, down and up. So the lower you go, the more the knee travels forward. So just going down as low as your knee allows, so it's not going over your toes. And the next exercise is a lunge position. Again, it's for the leg and your thigh. So in this position, we have one leg forward, one leg back. Checking that the back leg, the heels are off and you're on your toes. So it should feel a little bit hard to balance. So hold on to the wall if you're finding it too difficult to balance. And from here, we're coming down. Again, checking out the knee. The knee doesn't go past the toes, just like your wall squat. So gently coming down. Crystal's got the arms spread for balance, but you can just hold on to something. And then gently coming down, making sure you're breathing throughout this movement. And again, we're aiming for 15 repetitions, 3 sets to make a total of 45 repetitions. Now the next exercise, we're going to work on the hip abductors. It is one of the side muscles that's right on the side of the hip, protecting the hip on the side. So have yourself standing next to a wall so you can hold on for balance. Now what we want to do is see whether you can keep yourself standing up nice and tall. We're going to have the right leg lifting up to the side and then coming back down. Now you don't have to go very high like what Crystal is doing. Anything more than 10 to 20 degrees is good enough, but you go as high as your body allows. Now one of the important things to do is not have the body shifting to the opposite side as the leg is lifting up. You need to keep your body nice and straight and aligned. You can see Crystal here is very straight, only the leg is moving through. If you do it correctly, you should be feeling it around the hips on both sides. Even the one that's not moving, that's working hard. The one that's lifting, it's also working hard. They work differently. So making sure you do for both sides. If you have hip replacement done on one side, you need both sides done for this one. Same thing as before, 15 repetitions, and you're working through 3 sets. Now for the final exercise, we're going to stretch out the calf muscles. As you know, in the hospital, in the lying down position, calf muscles are so important for blood flow and also for prevention of DVT. We want the calf muscles to stretch out and also so we can put less pressure around the hip segment. So with this one, we're going to grab onto a towel. What I do is I fold it in half, just a standard size towel, fold it in half, and what I do is I fold it into 1/3. 1/3. And then you give it a good roll, make it nice and tight. And what you end up with, it's a tight roll of towel. Now once you're ready, we're going to place the towel about 50 centimeters away from the wall and have your foot stepping onto it with your heel touching the floor. If you can't touch because you're too tight, then that's okay, as long as you start to feel the stretch at the back. Do you feel a stretch at the back already? Yep, then you're holding onto the wall for a bit of support. And then here you go, that's a standard calf stretch. So on the towel, heel touch, knee straight. Okay, now if this is stretching too far, your opposite leg steps backwards. If you want more stretch, then the opposite leg steps forwards to make it stretch more. So adjust yourself so the stretch is run about a 7 out of 10. You don't need to smash it until you can't breathe, making sure that it is a 7 out of 10 intensity. So it's a gentle stretch. Does that feel gentle, Crystal? Yes. Great. So gentle stretching and holding it for 15 seconds rather than 15 repetitions. 15 seconds, then 3 repetitions on each side, and you'll find that the calf will just get softer over time. Now, compared to other types of joint replacement surgeries, such as knee replacement surgeries, hip replacement is relatively less painful and faster in recovery. But there are a few things that's good to know before you go into your surgery, and it's going to save you a lot of headaches. Now, my number 1 tip is about your pain medication and your anti-inflammatory medication. Now, after your surgery, you'll be given this medication in the wards following your surgery. But at that time, you're probably not going to feel much pain because the anesthetics are still not worn off in your body. Now, it's important that you start taking these medications straight away because it does take time for the anti-inflammatories to build up to an adequate level to give you the pain relief. Now, what some people do is that they probably don't take this medication in fearing that there might be some side effects, and because they're not getting pain, so they don't want to take this medication. And the result is that they actually got pain as soon as they start moving. Now, at that time when you want to come back and start taking your medication, a lot of times it's too late because it takes 1 to 2 days for this medication to work up to the level that's going to give you adequate pain relief. So my advice to you is start taking these medications straight away in the ward so you can get good pain relief for that initial few weeks where the effects are the greatest in the first 4 weeks for recovery. My next tip is on the range of movement of your hip. Now you're probably warned by your surgeon and also the nurses that after your operation that you're not allowed to bend your hip for more than 90 degrees. You can't bring your leg in towards the middle too far, and you can't twist your leg or twist your hip. Now, while that only 3 to 4% of the people do experience that hip dislocation after your surgery, this is something you want to totally avoid because that can lead to another surgery. That's something that's the last thing you want after your total hip replacement surgery. So it's important that after your surgery, you don't bend up your hip too high, don't cross your legs, and definitely don't try to put your socks on yourself. Now, prior to your surgery, it's also important for you to think about your home setup. Now, after your surgery, your movement will be limited, your function is going to be limited. So think about where your house setup is, where your bedroom is. Can you limit the amount of up and down stairs at home? So maybe move your bedroom to downstairs or the toilet access. And also put essential items like the telephone, food, tissue paper, somewhere it's easily accessible. The last thing I want to talk about is walking aids or crutches. Now, following your hip replacement surgery, you won't be independently walking around. You'll be using a gait assistance to move around. So it's either elbow crutches, your auxiliary crutches, or walking frames. Now your physio at the hospital will be showing you how to use these. But what you'll find is that following your surgery, you're still under anesthetics, you're still so overwhelmed with all those things that happen. You might be getting some pain, you might be feeling nausea. The last thing you want to think about is the coordination of how to use crutches. So it's important that you start looking into it before your surgery. Have a go at it so you get used to using these crutches. So after your surgery, you feel comfortable using them. Now I want to introduce you to use of crutches. Now these are my favorite type of crutches. These are called elbow crutches. I like this over other types of gait aids because when you're in it, it's very functional. Okay, when you let go, you want to grab onto something, the crutches stay there. You don't have to put it aside and you risk it falling on the floor. You have to bend down to pick it up. It stays there, so it's the most functional out of all the gait aids out there. But you might be given different types of gait aids in the hospital. It can be a walking frame, it can be auxiliary crutches, the ones that come right down in the armpit. All those are fine as well, but I'm going to demonstrate these because these are what I usually recommend my patients. So when you get a pair of elbow crutches, it's important to know that it's at the right height. Now your physio at the hospital should measure that for you, but you can also double check this for yourself, especially if you want to have a go before you go in for your surgery. So having the crutch by your side with you being upright, the handlebar should fall at your wrist. Okay, then this is the right height. So making sure you're not shrugging or you're not leaning forward, it's just a normal stance. And then the handlebar should be at the wrist height. Now once you're ready, we put the elbow crutches through, checking that the stick is at the back. A lot of people do that to the crutches. So making sure it is at the back for it to work properly. Now once you're ready, we are we're ready to get the movement happening. So first of all, you want the crutches go forwards first, and then you step with your sore leg or your hip replacement side, and then your good side. Okay, so stepping, hip replacement side, and then good side. So that's how it goes. Step and step, crutches, step and step. And this is how you use crutches initially after your hip replacement. So you've reached the end of my video, and these are my top tips to help you to maximize your recovery after your total hip replacement. If you want to learn more, or if you have any questions about what's in the video, contact one of our expert physiotherapists here at Dynamic Sport Physio on 3373-8770, and we'll be happy to answer all the questions you have in case you just get a bit confused about what's said in this video. Now I wish you a smooth recovery for your total hip replacement.